Here's another example of interface, vacuolar change here. There's a little bit of a lichenoid band here, but over here it gets kind of sclerotic, almost a little like lichen sclerosis I showed you earlier, but this is actually an example of lupus erythematosus. Here's another case of lupus. Lupus has a variety of features. It tends to have interface dermatitis along the dermal epidermal junction, often extending down follicles too. And then it has superficial and deep dermal perivascular lymphocytic infiltrate. It tends to have a lot of blue mucin, or that's mucin is what dermatologists tend to call this. In pathology, we might say it's myxoid. It has hyaluronic acid. And there's lymphocytes around eccrine glands. And usually this is one of those diseases that does not have eosinophils or has very few. So if you're thinking of lupus, but then you see a lot of eosinophils, that makes lupus a lot less likely. All right. Here's another example. When you get discoid lupus particularly, this can show up as kind of a solitary or kind of ring-like lesions on older sun-damaged skin, and it can look a lot clinically like an actinic keratosis or squamous cell carcinoma. And microscopically, because it's kind of chronic, the keratinocytes can look a little atypical. And sometimes there are AKs present in the background. So it's important to think about this. Anytime I see something that looks kind of like AK, but I see dying keratinocytes and deep perivascular lymphocytes, I think, ooh, could it be discoid lupus? And a classic finding is plugged follicles, dilated follicles with tons of keratin in them. And here's a closer look. The basement membrane tends to get real thick in discoid lupus too.